Urgent care clinics. Where did they come from? Why do they exist? And who can use them? The questions you want answered. To be honest, I'd never heard of urgent care clinics until the 2025 federal election campaign, when Barnaby Joyce said that the clinic in Armidale had closed down. They're not a particularly well-known or well-used service, although that's been changing recently. Urgent care clinics were proposed by Labor in the 2022 election campaign. After Labor was elected, 50 clinics were established nationwide. Later, the number of clinics was increased to 87, but then increased again by an additional 50 in March 2025, which will bring the total number to 137, expected to be operational by the end of the 2026 financial year. The goal of the clinics is to reduce the number of patient presentations to emergency departments, and to a lesser extent, reduce the strain on GP clinics. They're targeted at areas that have a relatively low number of healthcare services for the size of the population, where people generally have some difficulty accessing healthcare. In fact, it's been stated by the Labor government that when all clinics are operational, 80% of the population will live within a 20-minute drive from an urgent care clinic. Emergency departments have seen a steady increase in presentations over the past 40 years. Similar strain has been placed on GP services, which is largely caused by factors such as increasing population, increasing ageing population, difficulty getting an appointment with a GP, and GP gap fees, which have become widely implemented. Gap fees are necessary for GPs to stay in business due to the stagnation of the Medicare rebate, which usually lags behind increases in the cost of living. However, the gap fees make it either difficult or impossible for people on low or fixed incomes to see a GP when they need to. Data from the Australian Institute of Health and Welfare, the AIHW, indicates that emergency department presentations have risen by 150% since 1985. That's an increase of around 5.3 million presentations annually. Further, AIHW data indicates that approximately 40% of ED presentations were for non-urgent problems. Urgent care clinics operate near an existing GP clinic and are led by those same GPs. They're assisted by staff from community health centres, as well as Aboriginal community-controlled health centres. Urgent care clinics are designed to be as convenient and as desirable as possible in order to attract the maximum number of patients away from EDs and GP clinics. The urgent care clinics are all walk-in, with no appointments necessary, and also accept referrals from other GPs. They're open extended hours, all of them bulk bill, and they can provide patients with radiology and pathology services, which may be inside the clinic or nearby. Each clinic is also affiliated with a nearby hospital emergency department in order to provide rapid escalation of care if necessary. Referrals can also be made by the urgent care clinic doctors to various outpatient services. When you visit an urgent care clinic, you'll need to be assessed by the triage nurse, who will determine how urgent your condition is and whether you would be better off being seen by your own GP or, conversely, the emergency department. If either of those is the case, you'll be given a referral to take to the other health service, which helps to streamline your treatment. And if the doctor at the urgent care clinic decides you need blood tests or x-rays, they can also order them, and they'll be carried out on that clinic visit. Even though the clinics are run by GPs, They don't do regular follow-up GP care or repeat prescriptions. In this, they are the same as emergency departments, in which patients must see their GP for follow-up care. So urgent care clinics are basically GP clinics that provide rapid treatment. The list of problems treated at an urgent care clinic includes infections, minor fractures, sprains, minor lacerations, minor burns, rashes, allergic reactions, gastroenteritis. So most things you would see your GP for, but can't wait days for treatment. However, urgent care clinics don't treat life-threatening conditions such as chest pain, difficulty breathing, serious lacerations, serious bleeding, seizures, unresponsive patients, sudden numbness or paralysis. So pretty much anything you would go to the emergency department for. Urgent care clinics sit in between care from your regular GP and emergency care. Things that can't wait days, but are also not emergencies. You can visit health.gov.au to get the locations and opening hours of your nearest urgent care clinic. Thanks for watching. See you next time.